Hey guys, how are you? Dr. Stephanie Stroud here from Cornerstone Animal Hospital. I know I'm hopping on a few minutes early, but it's because I'm volunteering somewhere. So I am sitting in my car right now at Camp Quality. Camp Quality is a camp that is designed for children who have cancer, to try to help cheer them up and get their mind off of things. And so I'm sitting outside because I'm getting ready to go volunteer. I get to be a game master, so I get to play with these kids. I'm really excited about it. But I thought it would be a good idea to talk about cancer in our patients and our animal patients, because I'm getting to play with some wonderful children that have cancer right now. And so lumps and bumps, a lot of dogs and cats have them, a lot of other animals have them. What do we do about them? So lumps and bumps, if you're feeling a lump or bump on your animal, then it needs to be checked out, okay? So every time that there's a lump and bump, there's this big C word that's kind of scary that we call it. It's called cancer. And most of the time, if there's a lump and bump, it is some type of cancer. Now, that being said, not everything that is cancer means it's aggressive or means that it is malignant, okay? So about 1/3 of the amount of skin cancer we see is malignant, and about 2/3 is benign, which means it will not affect the patient at all except in that area, okay? And so how do we tell though? Okay, so you cannot look, in very few cases, you cannot just look at a lump or a bump on an animal and be able to determine what it is. The best way to tell exactly what that is and to determine whether it's a problem or not is to do what we call fine needle aspirate. So what that means is we collect some samples, some cells from that lump or bump with a little needle, and we look under the microscope, and that gives us an idea of what it is. Okay. In some cases, we actually have to go in and take a biopsy because the cells are not enough to tell us exactly what it is. So we have to do a biopsy to determine, is it aggressive or is it a benign type of cancer? Just like we would when we go to our dermatologist or we go to anything else, they send it off for pathology so that we know exactly what they're dealing with. Same thing for our pet patients, okay? When we have some type of lump or bump, we start getting some cells. If we see any cells that determines that it needs a biopsy, then we send it to the pathologist so they can tell us whether it's aggressive, whether it can be cured by surgery, whether it potentially needs further things, whether it's malignant, that type of thing, okay? But again, you cannot just tell what a lump or bump is just by simply feeling it. You cannot tell what it is simply by looking at it, because there are many lumps and bumps that can feel exactly the same, but can be very different, and some can be very aggressive and some can be very benign. So if you have an animal with a lump or bump, the best thing to do is take that your animal, your pet, your fur baby, to your veterinarian so that they can determine exactly what it is and determine what to do to best help you. So I'm going to get off now. I'm going to go play with some kiddos. I'm really excited. I think it's going to be an awesome thing. Camp Quality is an awesome thing that they really helped to do some good and help these kiddos that are dealing with a lot of stress in their life. So, all right, you guys have fun. Bye.